So Covered California is the health insurance marketplace for the state of California. Fundamentally, our role is to provide health insurance to anyone who needs it, anyone who doesn't have it from another source. So most people either get coverage through their jobs, through their employer, or they get it through a public program like Medicaid or Medi-Cal here in California, or Medicare based on your age or being below a certain income, etc. But there are a lot of people who don't fit into one of those buckets, right? People who are in the gig economy, freelancers, sole proprietors who are running their own businesses, people who retire at 55 before they're eligible for Medicare at 65. And those people still need healthcare and they still need insurance, and Covered California is where they can go.
And now, from San Francisco and the UCSF Rosenman Institute, the Health Technology Podcast with your host, Christine Winoto.
So many of us know how complicated health insurance can feel, especially if you're between jobs, working for yourself, or supporting a family on your own. In California, nearly 2 million people now have coverage through Covered California, a milestone that did not happen by accident, but through relentless policy work and outreach. Jessica Altman, Executive Director of Covered California, has seen the system from every angle. Her family's legacy in medicine shaped her path, but it was the passing of the Affordable Care Act and her early work in Washington that inspired her commitment to making insurance accessible for everyone. Before coming home to California, she launched Pennsylvania's state exchange and served as insurance commissioner, gaining a first-hand look at how regulation really works on the ground. In our conversation, Jessica talks about why insurance is so confusing and why Covered California is different, how state and federal policies shape real people's life, and why the hardest to reach uninsured are often the most complex to help. We talk about the power and the challenge of keeping coverage affordable, how California leads in reducing health disparities, and the creative ways Covered California supports people across cultures and languages. Jessica shares the lessons she's learned about meeting people where they are, fighting misinformation, and never assuming what families truly need. In this episode, you'll hear what sets California's approach apart, the evolving public opinion on healthcare reform, and why access is about more than policy. It's about real lives. And here's our conversation. Welcome, Jessica. Thanks for joining.
Thank you so much for having me.
It's so nice to have you. And I know that the open enrollment is over. So tell us a bit about your excitement for this year.
Yeah, we just closed out open enrollment for 2025 coverage. We knew heading into it would be a good year because we were offering a higher level of affordability than ever before with some expansions in a California affordability program. And we were also available to more Californians than ever before with an expansion to our DACA recipients in the state of California. But we closed open enrollment with nearly 2 million Californians enrolled in coverage through Covered California. That is nearly 200,000 enrollees higher than where we ended last year, which was itself a record year for enrollment on Covered California. So it's just incredible to see that level of progress, to see the role that Covered California is so privileged to play in delivering coverage to our residents. And we're excited to keep doing that work.
That's great. Well, that is very exciting. Before we jumped into everything about Covered California and what the progress that California has in terms of providing care and for many Californians, I like to start with your personal journey. How did you choose the path of being in healthcare, and also at the end of the day, like today is like, you're at Covered California. What's the career journey there?
So it starts with an apple not falling very far from the tree at all. I come from a family with deep roots in healthcare. Both of my grandfathers were physicians. My dad's father was a primary care physician who I remember doing house calls, carrying his black leather doctor's bag with him, even in his 60s and 70s, and doing that work. And my mom's father was an OBGYN and one of the first abortion providers in the country. So I come from that. Both of my parents work in healthcare or worked in healthcare. So it's not really a surprise that I got to where I am, but I had some really good timing in my career as well. Right when I was really looking for my career to launch, the Affordable Care Act passed, and I was lucky enough to get a role in the U.S. Department of Health and Human Services, one of the first hires to implement the pieces of the Affordable Care Act that impacted private health insurance broadly, but also specifically launching this new concept of a marketplace and the tax credits that are offered through marketplaces and all of that. And so that really kickstarted my interest, my passion for this work, both because it was new and exciting, but also because it was filling such a gap in the healthcare system before the Affordable Care Act, right? This is a group of people that we cover who are in economic and life circumstances where without the ACA, they wouldn't have health insurance. They were really shut out of the system in a lot of ways, either because of access or affordability or lack thereof or pre-existing conditions, right? And so it's really revolutionized how our healthcare system operates and even in a lot of ways how our economy operates. So my career took me then through the Commonwealth of Pennsylvania, where I served ultimately as the insurance commissioner there. And that has brought me to my home state, my beloved home state of California, and to cover California, where I have been here just about 3 years now in this role.
I'm always curious when I saw that insurance commissioner in a state. Like, what does the role of insurance commissioner?
Yeah. Well, it's a little different in every state. So it's a great question. So ultimately, an insurance commissioner is a regulator of insurance products. And insurance commissioners in most states regulate all insurance products. So it is fully insured health insurance products, but it's also your home insurance. It's also your car insurance. It's also your pet insurance. If you buy that life insurance, all of those products. In about a dozen states, including California, but not including Pennsylvania, where I served in that role, the position is elected by the voters. And in other states, including Pennsylvania, it's appointed and often Senate confirmed, as I was in the Commonwealth of Pennsylvania. So it's a really varied role. One of the things I think people don't always appreciate about it is in most state roles, there's a federal counterpart, and there is either federal oversight or federal funding or federal regulations. But insurance is truly a state regulated industry. And even some of the largest insurance markets in the world in states like California, Florida, Texas, Pennsylvania, right? It is really the state insurance commissioner who is the end all be all of what the rules are, what products are sold, how consumers are taken care of. And so there's a lot of interesting policy that happens in those state departments.
Do you think, what is the pro and con not having it at the federal level when everything is at a state level?
Yeah, I think with everything. I mean, healthcare, right? And what I do now, I'm in a federal state partnership. So I see the pros and cons either way. I think the pros of state oversight are you really are closer to your communities and their needs and their impacts. You're on the ground, you're hearing from people, you're seeing it in the reality. If there's a natural disaster, you're on the ground on the site, right? You really see that in practice and you get to know the players, the partners, the stakeholders who are in that industry, in that sector, in a way that, when you do your job well, you can really navigate those different intricacies in the right ways. And the federal government, the reality is they just can't possibly know every community in the country in the way that state and of course county and local officials do. And so there is that closeness. And, at the federal level, if there's something you get to do 10 of a year, like a compliance exam, you have to pick 10 insurance companies across the whole country, but in a state insurance department, it's only 10 within your state. So there is a lot more focus and resources that go to regulatory oversight of an industry that really is and needs to be highly regulated, right? I think the trade-off is every state is very different. Every insurance department is very different. The way they're funded, are they elected? Are they not? What's their priority? What's their focus? And there isn't always consistency in the rules from state to state. Often there isn't consistency at all in the rules from state to state. There are a lot of national model laws set through the National Association of Insurance Commissioners that do make their way to all the states, but often what the rules are in one state is very different from the rules in another state, and that can create inconsistencies and also be very hard for insurance companies trying to build a business across different states.
Do you think as a result of that, it increased a lot more of the administrative costs for health insurance company because they operate nationwide, but they are in different states?
I think that's an interesting question. I mean, I think you can add that, like with healthcare, it's like you have your federal oversight and your state oversight. I guess what I would also say is like rules exist for a good reason. And these are, again, insurance industries. Insurance is particularly hard, right? This is a thing that almost every consumer hates. They don't ever, you're buying a product you hope you will never need. I mean, that is fundamentally the challenge with insurance. You are thinking about what is your budget for the possibility of a thing that you hope and will try to have never happen. And that is a really difficult product to sell and to regulate. I mean, just to make sure that the insurance companies take life insurance. You're spending decades of your life paying a company so that decades down the line, if something happens, your family will be taken care of. You better hope someone is making sure that they are holding that money and being prudent stewards of those funds so that that money is there. So I think, that level of regulation is certainly necessitated. Could it be more efficient? I think anything could be more efficient, but it is also important.
Mm-hmm. So I want to also jump now to the Covered California. Tell us more about what Covered California is, because many people who are in California not necessarily know what Covered California is either.
Yeah, until you need us, and then
Right,
you'll find out
exactly.
which many people will. So Covered California is the health insurance marketplace for the state of California. Fundamentally, our role is to provide health insurance to anyone who needs it, anyone who doesn't have it from another source. So most people either get coverage through their jobs, through their employer, or they get it through a public program like Medicaid or Medi-Cal here in California, or Medicare based on your age or being below a certain income, et cetera. But there are a lot of people who don't fit into one of those buckets, right? People who are in the gig economy, freelancers, sole proprietors who are running their own businesses, people who retire at 55 before they're eligible for Medicare at 65. And those people still need healthcare and they still need insurance, and Covered California is where they can go. And this is where I talked earlier about the role marketplaces play in our economy. They really give people the economic freedom to make those choices to say, I want to start my own company, or I want to freelance, or I want to move to part-time, even if I lose access to benefits because I'm doing that because we have a marketplace. Importantly, Covered California and marketplaces in general, we're also the only place you can go to buy health insurance for yourself and your family and receive financial support in order to help pay for it. So we offer two types of financial support. One are tax credits that lower the monthly premium or the monthly cost of maintaining coverage. And the other is what we call cost sharing reductions that reduce out-of-pocket costs like copays and deductibles. In general, there's no income limitation for Covered California, but our financial assistance programs are generally available depending on your income. So the more you need, the more you get.
So in general, when people who are not in Medicare, they don't have insurance from their employer and not in Medi-Cal, are those people, if you're in California, then you buy your insurance from Covered California, or there's another option?
You can buy insurance for yourself. We call it off the marketplace. And it's the same coverage, but there's no tax credits and there's no cost sharing reduction. So people can do that, and some choose to, particularly higher income earners, to which there's no fundamental difference in the cost to doing so. But there's not really a downside to buying Uncovered California. But if you're eligible for financial assistance, and we do now have a program that is available regardless of your income, that lowers out-of-pocket costs, so that you can only get through Covered California. But we do still have people who buy insurance off the marketplace, generally directly from insurance companies or through agents and brokers operating in California.
And you mentioned earlier that this year you achieved the record numbers of signed up. And when you think about it, do you think there's a lot of people are still not captured by Covered California that they could have? Is it because they don't know about it, or they have other options?
Oh, such a complicated question. And this is the question we live and breathe here at Covered California. So, I mean, first of all, to level set, since the Affordable Care Act passed, Covered California has reduced, or California rather, has reduced our uninsured rate from over 17% to just 6.4% based on the most recent data. That is the largest percentage point drop of any state in the entire nation. So we've made incredible progress. And one of the things that I tell my team all the time is the better we do, the harder it gets, right? When we opened our doors for the first time in 2014, people were literally and figuratively lined up around the corner because they had been waiting for this. They had been shut out of healthcare and needing it for years, sometimes for decades, right? And we were available. But the people today who are still uninsured, they've had that opportunity for over a decade, and they're still uninsured for a reason. And those reasons are complicated. To put a number to that, when we started open enrollment, we estimated that there were 1.3 million Californians who were uninsured going without coverage, yet eligible either for no cost coverage through Medi-Cal or for tax credits through Covered California for lower cost coverage, or in some cases, no monthly cost coverage through Covered California. And so that's still a big number of people that we want to reach, believe we can reach, work very hard during open enrollment to reach. Of course, we hope we reach some of them, but it takes a while for the data lag to see how enrollment changes actually play out in terms of the uninsured rate overall and coverage in the state.
One of the things now, well, at least a few years ago, everybody was upset about the whole Affordable Care Act. And with the Covered California, there's a lot of benefit that, I mean, you mentioned because of the Affordable Care Act, now we have this Covered California. What are the things that make Covered California work so well that more people should have known about this so that they understand there's a lot of benefit of the covered of Affordable Care Act?
You know, the trajectory of coverage is so interesting. And I think when you have any big change like the Affordable Care Act, people feel like there's winners and losers, right? When the Affordable Care Act came, some people, of course, felt like, I've had a pre-existing condition. I haven't been able to get health insurance coverage. I am desperate for this, who were so grateful. And we've had those stories since the beginning, and we still hear many, many of them today. But there were also people who said, you know, what I had was working for me, and why do I have this mandate to maintain coverage now? Or, you know, I had this really cheap plan that didn't cover very much, but I didn't need very much, so it was fine, and now it's going away, and I'm angry about that, right? So you have that tension and this feeling of winners and losers, and that, of course, translates into and is connected to the political battles that ensued over the ACA holistically and pieces of it. I think over time, you know, people have realized the value of the overall shift towards access to coverage. And one of the things that people don't always appreciate about the marketplaces is our population is constantly changing. I mean, think about the populations I talked to you about. People who are retiring in an interim before they get on Medicare, people who are in between jobs or go down to part-time for a while or try to start their own business or whatever that may be. Our population changes constantly. And so while we cover 2 million people today, we've covered well over 6 million people in the decade that we've now been here in California. That's approximately 1 in 6 Californians. And so over time, the number of people who have needed this resource, needed Covered California, not to mention Medi-Cal and its expansion through the Care Act, which adds millions more people, it starts to personalize to people. I needed this. Someone I love needed this. I've seen the impact. What would this person or what would I have done had I not had this? And I think that's the journey our country has been on, that we have seen play out in the shift in public opinion on the Affordable Care Act broadly. Obviously, there's a very live healthcare debate in Washington right now. And it is in some ways similar and in some ways very different to the last round of sort of discussions around Affordable Care Act repeal or Supreme Court challenges, et cetera, right? We're no longer saying let's get rid of the whole thing. The language now is about improving it or redesigning it or reimagining it. I would pick your verb. But it's saying, okay, we have this baseline. We're accepting it as the baseline, and we may want to make changes from there. Many people agree with or disagree with strongly, but the baseline is different, and that reflects that shift in public opinion.
Do you, what do you think is the cause of the change of the public opinion?
Again, I think it's what I talked about. I think it became real to people over time, as the store is either they personally needed healthcare from a marketplace or from the Medicaid through the expansion, or people they loved did, and they saw that impact in a way that was not just abstract and thing they read about in the newspaper, but was humanized in people in their lives. And I do think that matters. I mean, people do care about their loved ones and other people if they really understand the impact.
Earlier, you're saying that nothing is perfect, and even now, the current administration in the past that is talking about repeal and change, and that did not happen. And because of the change of public opinion has changed too, there's somebody who can say that, well, maybe they don't use the word language repeal, but there's also another way that can be done, so it doesn't feel like it's going to be repealed, but it's going to change the way it is that actually is going to benefit fewer people or make it even more expensive.
Yeah, and not talking about repeal doesn't negate at all that there are big policy changes and big impacts that could potentially come from the conversations that are alive in Washington, D.C. right now. And at the end of the day, for better or for worse, a lot of this comes down to dollars. Healthcare in our country is incredibly expensive. The cost of that is borne through a combination of the federal government and federal funding for programs through various mechanisms and state funding. And if the federal government significantly reduces their willingness to fund any portion of that, people will lose, whether that's losing access to coverage, access to certain services, access to certain facilities, whatever that is. You can't just take dollars out of the system and have everybody keep everything they have today. That's just not how money works. And so, we're paying very, very close attention. There's a potential impacts to marketplaces. There is a lot of discussion about funding for Medicaid programs around the country, including Medi-Cal here in Covered California. That funding is shared between the federal government and the state government. So whether you call it reimagining, reinventing, whatever the word is, like there's a real human cost to a lot of the things that are being talked about. And I know there are many in California who are very vigilant and weighing in, paying very close attention to those discussions because they will matter here and everywhere else in the country.
And how is Covered California impacted if there's change in the policy at the federal level? Because there's a lot of talk on Medicaid, which is Medi-Cal, but Covered California is slightly different in a way.
It is different, though related. And I mean, Medi-Cal is our closest partner. We cover a lot of parents of kids who are on Medi-Cal, and our programs are sort of connected in our systems, so we can operate a no wrong door. In terms of the marketplace, I mean, I don't know what I don't know, and there will be a lot of federal regulations and legislation in the coming years that could impact us in various ways. The biggest thing that we are tracking, though, is what we call the enhanced premium tax credit. So I talked about the marketplaces from the beginning have offered tax credits to pay for the cost of health insurance for the people that get coverage through the marketplace. And those tax credits were available to anyone below what we technocrats call 400% of the federal poverty level. That's about $60,000 a year. for an individual person, and it goes up with the size of your household, right? And then there was this strict cutoff at that level, and anyone above that wasn't eligible for tax credits. During the pandemic and through large federal pieces of legislation, the American Rescue Plan, then the Inflation Reduction Act, they enhanced those tax credits. So they both made the tax credits more generous for those people receiving them under that $60,000 a year for an individual level. And they changed the rule so that above that level, you could get tax credits. And the new rule was you shouldn't have to pay more than 8.5% of your household income on your health care. So that population has access to tax credits for the first time. We've seen that population effectively double in terms of how many are getting coverage through Covered California. And it's just been an incredible contributor to affordability and to enrollment growth and to reducing uninsured rates. To put a statistic, like nationally, before those enhanced subsidies, there were around 11 to 12 million people enrolled in marketplaces across the country. The most recent data that was released in mid-January shows that number is now 24 million people. So it's effectively doubled the number of people enrolled in marketplaces around the country. Because affordability is the number one thing. If you can afford healthcare, of course you want it and will get it. And if you can't afford it, you have really tough decisions to make. Nobody wants to be uninsured, right? And so those have really been the difference between many, many people in California, across the country, actually particularly in states that didn't expand their Medicaid program under the Affordable Care Act, have seen their marketplaces just grow exponentially as affordability exists for people with these enhanced subsidies, in some cases for the first time.
So even though, and this, I know this is not in California, even though in a state that does not have the Medicaid expansion, the federal provide them with the tax subsidy in order for them to afford their healthcare.
So because healthcare is complicated, the way that it works is you can, if you expand your Medicaid program, people can get coverage up to 138% of the federal poverty level. You can get tax credits through the marketplace at 100% or above the federal poverty level. So in states that didn't expand Medicaid, it depends how high are they going up that income threshold. But if they go to, say, 90 or 100, anyone from 100 to 138, in California, they'd be on Medicaid. In that state, they're going to go to the marketplace and get the tax credits. But it is important to recognize there is still, in many states, a hole where their eligibility level may be 70, 80, 90% or less. And those people below 100 can't come to the marketplace and get tax credits either. It's just a sort of a funky piece of the way the original ACA was constructed, and how the reality of the outcomes hasn't necessarily been what people had planned from the beginning. But that's the result. So back to those enhanced subsidies, I think it's important. So currently, they expire at the end of 2025. And so in the Medicaid space, they're talking about proactively cutting the program in different ways. That's what the debate is. In the marketplace world, unless Congress proactively takes action to say, we believe this is the level of affordability that we want people to have, and we want to protect the coverage gains that we've made, they will go away. And so it's important that we be vigilant and understand that inaction is the same, right, as taking this away from people. Over 50%, I said our population changes all the time. Over 50% of the people we cover have only been covered since those enhanced subsidies were in place. They don't know another level of affordability. They don't have an appreciation that, oh, this is a temporary level of affordability, and then no worries, it'll go back to this other level. So I think we're estimating 400,000 people would leave Covered California, and many, many would go uninsured as a result of those expiring. So we obviously care deeply about that. This is a state that has worked so hard to expand coverage and cares so deeply about that work. And we want to do everything we can to keep moving forward and making progress and not take a step backwards, especially with that size.
One of the things that you mentioned, I think California has been successful in increasing coverage for their citizens. And what contribute to that success? Compared, why can't other states What can other states learn from California? I guess that's
So I'll put it in three buckets because truly California's approach has been throwing all the spaghetti on the wall of every strategy that you can think of and going with it. And it starts with affordability, right? There's no question that affordability is the number one thing. And so California, time and time again, from expanding the Medi-Cal program under the original ACA to further expanding it entirely on state dollars through what's called Health for All, which is to any California resident, regardless of immigration status, the only state in the nation to be that expansive. From before these enhanced tax credits that I talked about, funding a state tax credit to lower premium for those people around that $60,000 level that couldn't afford coverage, to now the California Cost Sharing Reduction Program. So we have invested in our healthcare system, invested in affordability on behalf of our residents in a way that really no other state has. So that's like the first order. Again, affordability is the foundation of getting people covered. If you don't have that, the rest of the things you try are not going to have an impact. The second is just deep investment in outreach, in marketing, in education. Cover California, you've probably seen our ads. You're probably sick of our ads. I love when people tell me they're sick of our ads because it means we're getting the word out. And it really does take people hearing things more and more and more to understand them, to gain that familiarity. And of course, not every person who sees our ads needs us. So we're trying to reach that certain group of people who need coverage, are uninsured, are going to be uninsured, all of that. We also have over 14,000 on the ground in community enrollment partners that help us do this work, right? So they are either certified insurance agents or community-based organizations that are operating in your community. They're doing in-language support. They're helping people understand what they're eligible for and navigate the system. And we continue to invest in these creative sort of in-community California for Californian solutions that create awareness, support health literacy, and also just support people through navigating our healthcare system, which is very complicated. We've also started, we really pride ourselves as a government agency on putting customer service first. If you call us, you can get a person on the phone quickly, right? I mean, and we hear rave reviews about our service center employees. They're incredible. But we've also done things like this past year. There was a very large group of people that were transitioning off of Medi-Cal because during COVID, they kept everyone who had Medi-Cal on it. They were adding more people, but they weren't sort of rechecking, are you still eligible? Because they wanted people to keep coverage during what was hopefully once in a lifetime pandemic. And so then they said, okay, we have to start that recheck process. And all of the Californians on Medi-Cal went through what we call a redetermination. And we knew a lot of them were going to come to Cover California. So we designed in close partnership with Medi-Cal a soup to nuts, totally tailored process to make that as facilitated, as simple, as easy to navigate as possible. And that, combined with the level of affordability we have today, we actually doubled the percentage of people transitioning from Medi-Cal because they find out, my income's too high now, we're coming over. We doubled the percent that actually enrolled in covers through Cover California, through increased affordability, through making the process easier, through supporting them through that journey. And a lot of that work too, we haven't talked about this a lot. California is so diverse. And so we do this work and are committed to doing it for all of our communities. And that means doing it in English, in Spanish, in Asian languages, and in a way that it is not just translated, it's culturally tailored to resonate with those communities, right? And so we've really deepened our efforts there to make sure we are doing all that we can for all of our communities. And, that showed in our enrollment growth. We've seen disproportionate growth among Latino enrollees, among African-American enrollees, among American, Indian, Alaskan Native, Spanish speakers. So while we're increasing coverage, we're also reducing disparities in access to coverage. And that is really rewarding to see because we put a lot of time and energy and effort into that work.
Mm-hmm. I know we are running out of time. Couple more questions. I was talking to somebody earlier this year that they mentioned about, we were talking about why everybody's so angry about the health insurance and the government in terms of providing healthcare coverage. And one of the things, many of them sometimes they don't even realize that Medicare is a government program. And because they would get the card would have the companies of the insurance company's name rather than the government of the United States. My question to you, do most people aware that Covered California is a government or a state program?
No. I could try. So it is complicated. And actually, one of the things that we struggle with is how to simply and concisely explain to consumers in an advertisement or on a billboard, right? Who is Covered California? And the truth is, it's complicated. I mean, we are a state government agency, but we are independent. We are a marketplace, so we offer private health insurance companies, but we are not a private health insurance company. Many people think we're an insurance agent or brokerage or one of those other entities online selling insurance. We're not that in a for-profit way, but we are a marketplace selling insurance, and we do have insurance agents that operate trying to sell Covered California. So first and foremost, I do not blame consumers for being confused about this, whether related to the marketplace or Medi-Cal or Medicare, because we've really worked hard in this country to make our healthcare system as confusing as it can possibly be. Our focus is to really try and cut through that noise by simply saying who we are, but also what we offer. And we do a lot of focus groups, message testing, qualitative interviewing to understand how our brand is understood and perceptions of our brand, of Californians, what are the barriers to people. I'll give you, one really interesting example. A lot of people on Covered California pay $0 a month for a comprehensive quality health insurance plan. We put that in message testing and people thought we were a scam. It can't be true. There's no way it's $0. That's hooey. But we then started putting $10 or less, and that was more believable. And so if you see our ads, they say $10 or less and not as low as $0, because that is a message that resonates with people. And in many ways, we're trying to counter these long held and candidly earned perceptions of the healthcare system. People tell me all the time, I called you and I thought there was no way I was ever going to speak to a human, right? Just something as simple as that. Or I thought I would have to wait on hold for 2 hours to talk to a person. I mean, those things that we have to get people to us to prove to them that we are really delivering on affordability, on access, on quality health plans. And we work very hard to do that. But we should also recognize our healthcare system has earned its bad reputation. And so we have to really prove to consumers, to Californians, that we are doing the right things and we can deliver to them what they deserve. And we try to do that every day.
Mm-hmm. Last question. What are the lessons learned that working with, doing the Affordable Care Act and then the Covered California, what can we do to make people understand better about healthcare? I know it's complicated. Is there a way to make people understand the complicated part of it in a simple way?
I think my lesson learned is never to make assumptions about what people know, what they don't know, what they want, what they need. Go to people and ask them, because they certainly will tell you. It doesn't take a rocket scientist to tell you that, yes, if you make something more affordable, more people will want it. But truly, no one in healthcare still understands what is affordable, because the truth is, what is affordable to one person is not affordable to the next person, because every person has their own challenges, their own constraints, their own trade-offs in their life. And so it really is about meeting people where they are and recognizing that you could have the best public policy, the best new law in the world, but if you can't translate it to people and deliver it to people and have people navigate the system to get it, it won't mean anything. And focusing on that consumer centricity is how we talk about it at Covered California, the consumer experience, the consumer knowledge set, the consumer perception, that will make any program, any government program or any private product so much better. And I think candidly, government could do more of that. It's something we're very proud to invest in heavily at Covered California.
That's great. Well, thank you. Thank you for your time and sharing your story and insight.
Thank you for having me.
Thank you for tuning into today's episode of the Health Technology Podcast. We hope you found the conversation insightful and inspiring. If you enjoyed this episode, please take a moment to subscribe, rate, and leave a review on your favorite podcast platform. Your feedback helps us continue bringing you the latest in health innovation. Stay connected with us on LinkedIn and Twitter for updates on upcoming episodes and more. Until next time, keep pushing the boundaries of what's possible in healthcare. I'm Christine Minotto, and thank you for listening.